Good day, everybody. It's Andrew here, and welcome back to my channel. We've got huge updates today on stimulus and Social Security benefits, as we have a new proposal for $1,200 per month stimulus payments for certain people if you qualify based off of your income. Now, this is still just a proposal, but it has a lot of support. So let's discuss the details and exactly who would qualify. But first, do me a quick favor, hit like, hit subscribe, and share this channel with anyone who you think might find this helpful. This is a community for seniors and those who are disabled, and my job is to be a voice for you to make sure that President Biden is keeping his promise to increase Social Security benefits, increase SSI, SSDI, and VA benefits as well, and even potentially approve stimulus checks for seniors. So do me a quick favor, if you really want to support my work, subscribe to my second channel. The link to that is going to be in the comments of this video, and on that channel we're going to have some updates as well, but it's mostly going to be a community for seniors. I'm going to be on camera with a live chat so you can talk with me and talk to others in the community as well, and we're going to be playing games like bingo, casino games, and even playing the lottery as well. So for those of you who have already subscribed, thank you so much. We're about to hit 5,000 subscribers on that channel, and I'm going to be giving away stimulus checks as a thank you just for supporting my work. My plan is to hopefully give away one stimulus check per week, hopefully more than that depending on how big the channel gets. So to those of you who have already subscribed, thank you so much for supporting my work. Okay, so before we jump into the stimulus update, let's do a quick update on daily trending news. Now, at this point, most of you know that Chris Cuomo was fired from CNN, and let me know your thoughts in the comments, guys. I think most people would agree that it's probably the right thing to do, but some people disagree, so let me know your thoughts. And I thought it would be interesting to show you how CNN is reporting this, right? Because CNN, obviously everyone's reporting on this, but CNN themselves released a video kind of explaining what happened and why he was fired. So I thought it would be interesting to see how CNN is covering this themselves. So let's take a quick look. Probably going to be a few minutes, and then we'll jump right into stimulus.
You know the biggest media story this weekend. It's the firing of Chris Cuomo from this network, CNN. Now, I've been working the phones ever since this was announced yesterday evening. Frankly, I've been on the phone until the last 5 minutes here getting information about what happened and where CNN goes from here. So I'd like to start, now that you know the news about Cuomo's firing, with a timeline of how it came to this point. Why was Chris Cuomo fired now, after CNN management supported him all year long? That's the key question I've been pursuing as a media reporter for the past, 18 hours or so. So here are the answers I have so far. Let's take a look at the day-by-day timeline this week to catch you up. On Monday, the New York Attorney General's office released that document dump. It landed with a thud. There was a lot to read, some of it damning, some of it about Chris. Now, Cuomo's view is that he never engaged in opposition research on behalf of his brother Andrew. Cuomo says he's never smeared anyone. He never went after any of his brother's accusers. Plus, the Attorney General's office never accused him of that. But the documents, especially the text messages between Cuomo and his brother's aides, showed a level of coziness with the governor's staff that was alarming to many. CNN leadership on Monday bought some time to scrutinize the documents by saying it would conduct a thorough review. So that was on Monday. On Tuesday, Cuomo's producers were back at work to produce another episode of Cuomo Primetime. But there was growing criticism of the anchorman, both outside and inside CNN. By the evening, management had seen enough in the documents to take action. Cuomo was suspended, quote, indefinitely, pending further evaluation. This language made clear that Cuomo was not just being benched for a week, in some sort of performative punishment. This was a real reprimand. But the language also left the door open for Cuomo to possibly return after the holidays, depending on that quote-unquote further evaluation. It seemed clear to me that management was balancing the concerns of staffers with the feelings of viewers. On one side, important complaints about Cuomo crossing clear journalistic lines and damaging CNN's brand. On the other side, concerns about Cuomo as a person and respect for the fact that he put his family first. And you know what? Some people felt all of the above. My phone was lighting up on Tuesday with calls from CNN staffers, some of whom said Cuomo should have been fired right away, but also with emails from viewers saying CNN was being unfair to the anchorman. So there was this balancing act going on. Now, unbeknownst to viewers or staffers, CNN management also engaged a premier law firm, Cravath, to assess the document dump. By Wednesday, with Cuomo's suspension all over the news, Cravath was quietly at work looking through the texts, looking through Cuomo's public statements, looking to see if it all lined up. At the same time, CNN boss Jeff Zucker held a meeting with the staff of Cuomo's primetime show, and the sentiments there were clearly in Cuomo's favor. This part has not been reported anywhere I've seen. Those staffers for the 9 p.m. show talked about the anchorman's talent and the pride they felt in the show. So there was a real wide array of feelings in this house. You've got CNN staffers saying, get rid of him, he shouldn't work here, he's hurt us. And then you have some of his own producers saying, let's bring him back, he should be back. Now here's the other thing that was unknown to the staff, or the press, or the public. Late Wednesday, a lawyer contacted CNN with a sexual misconduct complaint about Cuomo. On Thursday, CNN management reckoned with that charge, which is from an anonymous woman who worked with Cuomo years ago at ABC. The New York Times and other outlets had investigated Chris in the past, looking for signs of the same allegations that caused his brother's political downfall. So when a CNN spokesperson announced that additional information came to light, it was referring to that misconduct allegation. Now, right now, I know almost nothing about the allegation. Nothing's really been reported about it publicly, other than the fact that this staffer worked with Cuomo at ABC. But we'll catch up to that in a moment. We're on the timeline here. We're up to Friday. Okay, according to two sources familiar with the matter, the law firm, Cravath, turned in the results of its review on Friday. And the review said that CNN had grounds to terminate Cuomo. Zucker made the decision and notified Cuomo of his firing early Saturday afternoon. And then Zucker said in a memo to CNN staffers, quote, "It goes without saying that these decisions are not easy, and there are a lot of complex factors involved." Chris Cuomo said in a statement that he didn't want his CNN career to end this way, and he thanked his staff for the great work that they've done over the years. As for the misconduct claim, the New York Times broke that news late last night, late Saturday, with attorney Deborah Katz saying her client, quote, came forward because she was disgusted by Chris Cuomo's on-air statements about his brother earlier this year. So far, let me just double check my emails as we're talking here. So far, Katz has not responded to my request for comment today, but a spokesperson for Cuomo has responded and said these apparently anonymous allegations are not true. Times reporter Jody Cantor pointed out both Cuomo brothers have lost their positions in the wake of Me Too accusations. So, what happened here? This is about a confluence of factors, about a series of headaches that seemed like they were never going to end. I said on the air last night when the news broke, this seems like a case of death by 1,000 cuts, and my reporting sense backs that assessment up. This was about not any single headache, but many headaches that continued to pile up. So it seems CNN management had decided to terminate Cuomo based on the law firm's review, based on the document dump, based on his behavior with his brother. And then this sexual misconduct allegation also came along, and it was yet another factor. A CNN spokesperson saying overnight, when the new allegation came to us this week, quote, we took them seriously and saw no reason to delay taking immediate action. So there's still some unknowns here, some unknowns about what that sexual misconduct allegation is. It's possible that reporters will reveal more in the coming days. As I mentioned, I have not heard back from that lawyer yet. But Cuomo's defense, the outside PR person he's hired to defend him, says these apparently anonymous allegations are not true. So there is a lot more to unpack here. It's been a bruising week for CNN and with a significant change in prime time, and there could be more fallout to come.
Wow. So not only was he being fired for helping his brother, but now we have some allegations against Chris Cuomo himself, who worked for CNN. So let me know your thoughts in the comments, folks. I know this isn't really related to stimulus, but I like to share the daily trending news as well. Now let's jump right into these $1,200 per month stimulus payments, which have been proposed in the House. Now this article is titled, Monthly Stimulus Checks, Ilhan Omar Proposes Bill for Regular $1,200 Stimulus Payment. So let's dive into this and see exactly what the proposal is. Now, Representative Ilhan Omar, along with other progressive Democratic lawmakers, proposed legislation that would dole out regular stimulus checks or universal guaranteed basic income, whatever you want to call it, through monthly payments of up to $1,200 for adults and $600 for children. So, the Minnesota Congresswoman announced the proposal on Friday, saying that poverty is a choice in a press release and a Twitter post about the proposed legislation. So, Representative Omar said, poverty is a choice. It is a choice from the government whether or not to help the people who are in poverty. So, she proposed a bill that will create a guaranteed income program of up to $1,200 per month for adults and $600 for kids as a pilot program that would last about 4 to 5 years. And if it went well, it would eventually be done nationwide. So let's see exactly who would qualify for this program. Again, this is if it was actually put in place. And again, this would be a pilot program that would last about 4 to 5 years. And if things went well at the state level, it would be done nationwide. So this would create a $2.5 billion grant program to fund pilot guaranteed income programs across the country. The programs would be studied from 2023 to 2027, and then the national program would begin in 2028. Now, who exactly would qualify? Now, this would provide $1,200 per month to anyone making less than $75,000 per year. Heads of household could make up to $112,000 per year, and any minor 17 years or younger would receive $600 per month. Now, this structure is similar to that of the three stimulus checks that were approved at the national level. So this was proposed in the House. Again, this is just a proposal. It still hasn't been signed into law or anything like that. But it just goes to show you that there is always proposals and things in the works to help people who are low income. And this would specifically help a lot of people on Social Security benefits. I believe it's about a third of people who are retirees live either in poverty or near the poverty line. So these programs coming out is really, really good news, because the more we see these programs come out, the more chances we have of them actually being fully signed into law. And of course, Representative Ilhan Omar is one of the most progressive representatives, and she works a lot with Bernie Sanders to try and get these stimulus packages done. So I will keep you updated, guys, as things develop with this proposal. Hopefully this will come to fruition soon, but as of now, this is just something that is kind of in the mix with all of the other proposals we've talked about on this channel. Now, to end this video, I'm going to leave you with a clip from President Biden talking about the Build Back Better stimulus package and how it should be lowering prescription drug costs, specifically for seniors who are on Medicare. Now, as of now, the stimulus package includes a few things that would help lower drug costs for seniors. First of all, it allows Medicare to negotiate with pharma companies, which would break drug costs down not only for Medicare, but for the patient as well. This is something the Veterans Administration already does, and they pay a lot less than Medicare for medications. It also wants to increase taxes on pharma companies if they increase drug costs at a higher rate than inflation, as well as creating a cap on out-of-pocket payments for seniors who are on Medicare Part D plans, capping that at $2,000 per year. So there's a lot of good stuff in here for seniors, and let's take a quick look, see what President Biden had to say. Let me know your thoughts in the comments, and I'll see you on the next video.
Today, I'd like to talk about how we're going to help millions of Americans protect and preserve their health and live with the dignity of knowing that they can care for themselves and their loved ones, all by making the cost of prescription drugs much more reasonable. At the outset, I want to be clear. We acknowledge the groundbreaking, life-saving work that many pharmaceutical companies are doing. Look no further than the vaccines and the treatments they're manufacturing and delivering that are helping fight this pandemic. Our miraculous therapies have, in some cases, turned diseases that were once considered death sentences into treatable conditions. But we can make a distinction between developing those breakthroughs and jacking up prices on a range of medicines which have been on the market for years without making a substantive change in the medication itself, the medicine itself. Here in America, it will not surprise you to know that we pay the highest prescription drug prices of any developed nation in the world. Let me say that again. We pay the highest prescription drug prices of any developed nation in the world. That may surprise you. What may surprise you is we pay about 2 to 3 times what other countries pay for the same drug. An example, one anti-cancer drug costs $14,000 in the United States. That same exact drug by the same manufacturer costs $6,000 in France. Today, 1 in 4 Americans who take prescription drugs struggle to afford them. Nearly 30% Nearly 30% of these patients have skipped doses of essential drugs that they have to take. Others have simply not fulfilled the prescription, tried to use over-the-counter drug and cut pills in half, or because they can't afford the cost of the prescription. You know, even if you think this doesn't affect you, it does. Everyone has less money in their pockets because high drug costs make health insurance more expensive for everyone. There aren't a lot of things that almost every American can agree on. But I think it's safe to say that all of us, whatever our background, our age, where we live, we can agree that prescription drugs are outrageously expensive in this country. It doesn't need to be that way. Under my Build Back Better bill, which is passed the House of Representatives, it won't be the same way. One of the most egregious examples of what's happening with drug prices regarding the treatment of diabetes and the cost of insulin, a drug that people with type 1 diabetes need to take throughout their lives to control their diabetes and stay alive. It's almost exactly 100 years ago that a 14-year-old boy in Canada, dying of diabetes, became the first person to receive an injection of insulin. Today, one bottle of this life-saving liquid costs less than $10 to manufacture. But in certain types of insulin, prices increased by 15% or more each year for the past decade. Depending on the nature of someone's type 1 diabetes, the average sticker price for a month's supply of insulin is about $375. But some people, it can be as high as $1,000 a month because they need to take more. I just met with two lovely women we see in front of me today here. And Sarah Skipper was diagnosed with type 1 diabetes at age 5. She has a sister, Shelby, who was diagnosed at age 8. She told me that affording insulin has been the challenge of her and her family's entire life. Sometimes she and her sister ration doses. In 2018, Sarah was no longer covered by her parents' policy. Although she was working 2 jobs, she hadn't met her health care plan's deductible, and insulin was about $1,000 a month supply for her. So she started sharing her sister's insulin from the same vial. At one point, because Shelby thought Sarah had taken her dose, that Shelby cut a dose in half because the bottle was sitting there and it would look like it was half empty. Is that correct? And at that time, she thought, well, I guess what? I guess she hadn't taken it yet. Shelby had been hospitalized as a consequence for 4 days, working 2 jobs, sharing insulin from the same vial in America. Shame on us as a nation. We can't do better than this. Sarah's about to start a new job and doesn't yet know what the insulin will cost. Sarah said, this is a quote, I wish I could make a decision that didn't include diabetes. She shouldn't have to ask such a question. You know, I think about what just happened with Aisha, who's diagnosed with diabetes 3 days before her 21st birthday, having to choose between rent and groceries and medication. Quote, relentlessly, without relief every day was your quote to me. Having to ration her supply and feeling herself, as she says, slowly dying, she ended up in a coma. Think about that. The difference between nearly dying and thriving is the cost of one drug. Sarah and Aisha are far, far from being alone. It's estimated that 34 million Americans, 10% of the population, have diabetes, including more than 1.5 million who have type 1 diabetes, requiring daily doses of insulin in varying quantities. Remember, all of this stress, hardship, suffering, and sacrifice is due to a drug that costs just a few bucks to make. One study found that Americans pay 10 times as much as other countries for insulin. These price increases are about companies looking to maximize profits, and nobody standing up for the patients. Nobody with the power to do something about it. It's enough. Nobody has held the manufacturers accountable until now. My Build Back Better bill takes 3 key steps to lower the cost for families dealing with diabetes. First, We're going to cap cost sharing for insulin at $35 per month. That means you can't get charged more than $35 at a pharmacy counter for your insulin. That's across the board. Whether you get health insurance through your private policy, the Affordable Care Act marketplace, or through Medicaid, nobody is going to pay more than $35 for each month for insulin. Second, for people who don't have health insurance, we're helping you get insurance. That way, people with diabetes can get protected with that $35 copay cap. People who are uninsured today can visit healthcare.gov to check out the options. In many cases, people can get a full health care plan, including coverage for insulin and other prescription drugs, doctor visits, and hospitalizations for less than $10 a month if you sign up for the plan. If you live in a state that has refused to expand Medicaid under the Affordable Care Act, my Build Back Better bill is going to fix that as well. These changes are going to ensure access to affordable coverage for millions more Americans and help more people with diabetes get coverage they desperately need. Third, we're going to end the days when drug companies could increase their prices with no oversight and no accountability. Going forward, drug companies that increase their prices faster than inflation are going to face a steep excise tax. In other words, if you're saying to we're saying to drug companies, if you're finally doing it because to be accountable, when your prices to the American people go up, you're going to be accountable. This is important, not only from a health standpoint, but from the standpoint of personal dignity. Imagine if you're a parent of one of the roughly 200,000 young people in this country that suffer from type 1 diabetes. Imagine if you can't afford their insulin. It's not only a risk to your child's life, it deprives you of your dignity. Just imagine, as a parent, having a child with type 1 diabetes and not a damn thing you can do about making sure they have it. You've sold what you can sell. You don't have the money to get it done. Well, my plan addresses an additional fear patients face, which is that when their children are starting their careers and are no longer eligible in their parents' health care plan, they'll be able to get insulin that they need. Outrageous costs affecting everyone across the board, spanning every kind of condition and disease. I remember what it was like when my mom, when she got older and moved in with us. Her prescription drugs were thousands of dollars on a monthly basis. Fortunately, I had 3 other siblings, and we collectively had the means to chip in, so she didn't have to exhaust all of her savings and sell whatever she had left to make sure she could get her drug costs covered. So I'm committed to using every tool I have to lower prescription drug costs for Americans, consistent with the drug companies getting a fair return on their investment. To really solve this problem, we need the Senate to follow the House of Representatives' lead and pass my Build Back Better bill. In addition to the specific progress that the Build Back Better bill is going to make for families facing diabetes, it will also take the additional step of lowering drug costs for people on Medicare. Right now, the only thing Medicare is not allowed to negotiate, they can negotiate the cost of doctor's visits, hospitalization, all the rest. The one thing they can't, as a matter of law, they are not allowed to negotiate the price for prescription drugs. For everything else, doctor's visits, crutches, they can negotiate. My plan gets rid of that prohibition. What I'm proposing is that we negotiate a fair price, one that reflects the cost of research and development and need for significant need for significant profit. But that is still affordable to consumers. Right now, drug companies will set the price at whatever market will bear. My plan also caps the amount that seniors on Medicare have to spend on prescription drugs each year to no more than $2,000 per year, with Medicaid and drug companies picking up the rest of the cost. And again, our plan says that any drug company can only raise prices based on the rate of inflation and caps insulin cost sharing at $35 a month. So let me close with this. I've long said health care should be a right, not a privilege in this country. And the women I've met with today, and millions like them, are the reason why. People for whom the cost of one drug is the difference between hope and fear, life and death, dignity and dependence. We're closer than ever to passing my Build Back Better bill and providing people suffering from diabetes and so many other diseases the medicines they need and the dignity they deserve to be able to afford them. This is not a partisan issue. Diabetes, Alzheimer's, cancer, so many other diseases, they don't care if you're a Democrat or Republican. It's not about whether or not your loved ones can afford a prescription drug you need. So we need Congress to finish the job, to come together and make the difference in people's lives.